Hello everyone and welcome to today's lecture on the goals of physical education, exercise science, and sport. This is part 2 of chapter 2. We'll explore key objectives across cognitive, affective, and psychomotor domains, and we'll also dive into the role of assessment and current trends in our field. Let's get started. When we think about the purpose of physical education and exercise science, we often think of movement and fitness, but it's deeper than that. The goals provide direction for what we aim to achieve, while the objectives define specific, measurable outcomes that support these goals. Together, they guide our teaching, coaching, and programming. Objectives are derived from the broader goals we discussed earlier, but they're much more specific. They describe what learners should know, do, or feel as a result of instruction. In other words, these are the short-term measurable outcomes that we aim for in each lesson or activity. When you think of objectives, think of them as building blocks. Each one contributes incrementally to achieve the overall program or course goal, much like our learning objectives at the beginning of each chapter. Designing and delivering programs in physical education, exercise science, and sport, it's essential that we understand both the overarching goal and the purpose behind our work. The primary goal is to improve the well-being and overall quality of life for those who participate in these programs. This means we are not only enhancing physical health, but also promoting health, mental, emotional, and social wellness. The main purpose then is to equip individuals with the skills, knowledge, and attitudes they need to stay active throughout their lives. Lifelong physical activity doesn't happen by chance. It requires education, encouragement, and opportunities to engage in meaningful movement experiences. As professionals, our job is to help people see movement not just as exercise, but as a path to a healthier, more fulfilling life. In physical education, exercise science, and sport, we classify learning objectives into 3 key domains. Cognitive, which is related to thinking, knowledge acquisition, and intellectual development. Affective is focused on feeling, attitudes, values, and emotional growth. And psychomotor, which is centered on doing, including movement, coordination, and physical skills. These classifications help professionals organize and target instruction based on the desired type of learning. To further support this process, we use taxonomies, frameworks that guide us in planning learning outcomes. These taxonomies organize objectives in a progressive hierarchy from simple to complex, or lower order to higher order skills, and are rooted in developmental theories, meaning they reflect how individuals typically grow and learn over time. They provide a structured approach to designing lessons, assessments, and long-term goals. The cognitive domain is all about knowledge and intellectual skills. This includes understanding heart rate training zones, knowing how to monitor your heart rate, or being able to adjust a workout plan based on your individual needs. We want learners to think critically and become informed participants in their health and wellness. This chart outlines the cognitive domain, which is a classification of learning objectives focused on mental skills and knowledge acquisition. It includes 3 categories: remembering, understanding, and applying, each with descriptions and example applications across physical education, exercise science, and sports programs. Here's a clear summary. So the cognitive domain, one of those key categories is remembering, and that is the ability to recall information from long-term memory. This is the most basic level of cognition. And as far as applications are concerned, with physical education, we ask the question, what are the critical elements of the overhead clear in badminton? For exercise science, what are the health-related components of fitness? And for sports programs, what are the primary rules of basketball? A second category is understanding, and it's the ability to interpret and construct meaning from instructional materials involving summarizing and estimating or translating. And if we look at physical education specifically, we compare the overhead clear in badminton to the softball or baseball throw, or in exercise science, comparing health and motor components of fitness, or with sports programs, how are our basketball rules similar to soccer? And the third category is applying. And that is about the ability to use knowledge in new situations. It involves using methods, rules, and concepts. In physical education, when is the best time to use the overhead clear in badminton and why? And in exercise science, what exercises would you prescribe to a 40-year-old woman just starting to exercise? And for sports programs, as a point guard, what movements could you do to get open after picking up your dribble under pressure? The affective domain involves values, attitudes, emotions, and self-perception. Here we're helping individuals build self-worth, respect, and a positive relationship with physical activity. For example, when someone values physical activity for the enjoyment it brings or the challenge it presents, that's an affective outcome. Krathwohl's taxonomy helps us understand how these values develop over time. Here in this chart, we're talking about the affective and social domains, again, that deals with attitudes, emotions, values, and social interactions. So the three categories, one of the three categories is receiving. And this is about being aware of or the sensitivity to stimuli, the willingness to listen or be attentive to others or events. And it represents a basic level of emotion and social engagement. In applications of physical education, the student follows the teacher's directions. In exercise science, it's a cardiologist listens to a patient describe their symptoms. And in sport, it's about the players choosing to shake hands with the opposing team after a win or a loss. The second category is responding, which is actively reacting to stimuli, showing engagement through behavior beyond simple awareness and overt participation or feedback. In application with physical education, students choose to use rock, paper, scissors to resolve a dispute about whether the ball was in or out rather than arguing. With exercise science, a client questions the benefits and side effects of a new fad diet. And in sport, a player practices hitting in the batting cages outside of required team practice. Finally, the psychomotor domain focuses on movement skills and physical performance. We start with basic motor skills and progress to more complex and highly skilled movements. Objectives in this domain also include developing physical fitness, whether it's mastering a sports skill or improving endurance. These are key physical outcomes we aim to achieve. And again, this chart is a representation of the psychomotor domain and the different categories associated. So imitation is learning by observing and copying others. It's early stage skill acquisition that may lack refinement. And with physical education, students imitate a teacher's basketball shooting technique, first without a ball, then with a ball and self-space before shooting at the basket. In exercise science, yoga participants follow the instructor's guidance, transitioning from downward dog to warrior two. And in sport, volleyball players mimic the coach's demonstrated spike approach without a ball before engaging in a drill. The second category is manipulation, and this is where you're performing skills by following directions and practicing, beginning to refine those movements through repetition and guidance. So students choose from poly spots in a basketball drill without defenders for 10 minutes at the start of class. And the yoga class participants create and perform their own warm-up pattern using 4 different poses. Whereas in a softball drill, players practice a soft toss drill in small groups, working on hand-to-eye coordination based on the coach's instructions. Assessment should never be an afterthought or a one-time event. Instead, it must be seen as a dynamic, ongoing process that is integrated into all aspects of a program, whether in a school, community, or clinical setting. Assessment is a crucial element of quality instruction and programming. Why? Because it provides valuable insight into participants' progress. How well are they learning and developing across the three domains? It gives feedback on program quality. Are the methods and content working? And information on instructional practices. What's effective and what needs adjustment? And evidence of professional effectiveness. Are we meeting our intended goals? In short, assessment gives us meaningful data related to learning and achievement in the cognitive, affective, and psychomotor domains. It connects directly to our goals and objectives and helps us ensure that we are truly making an impact. Measurement involves collecting data like tracking a mile time or a number of push-ups. Evaluation is interpreting that data. What does it mean for performance or improvement? An assessment combines these to give us a complete picture. It helps us determine if students or clients are on track towards their learning goals. Now that we've established assessment as an essential ongoing part of physical education and sport programs, let's break it down into its key purposes. First is diagnosis. Assessment helps us identify strengths, weaknesses, or special needs. This can guide individualized instruction or interventions. It also helps with placement, which ensures that participants are placed into groups, levels, or activities appropriate to their current ability and readiness. And the monitoring of progress. Continuous assessment allows us to track development over time and adjust instruction as needed. It also helps with the determination of achievement. It verifies whether learners have met the goals and objectives established for the program. And motivation. When individuals see progress, it boosts their motivation to help working towards personal goals. And program improvement. Data gathered through assessment can highlight areas where a program is succeeding or where changes are needed. Evaluation of instructor effectiveness. Finally, it reflects on us as professionals. How well are we facilitating learning and growth? Each of these purposes contributes to a more effective learner-centered approach in both school and non-school environments. Technology is transforming assessment. Tools like the FitnessGram and ActivityGram help evaluate fitness levels in youth. Wearables and apps like smartwatches and fitness trackers allow for real-time feedback, personal goal setting, and self-monitoring. As professionals, embracing these tools allows us to engage learners in new and meaningful ways. In summary, current trends in our field reflect a greater emphasis on holistic health, inclusivity, and lifelong physical activity. There's a growing integration of technology, interdisciplinary approaches, and a shift toward making physical education more meaningful and personalized for every individual. As kinesiology continues to evolve, an expanding array of professional philosophies will shape the practices of current and future professionals. National initiatives like Healthy People 2020 and the National Physical Activity Plan offer comprehensive guidelines to promote healthy, active lifestyles across the lifespan. Additionally, the growing use of smartphone apps and activity trackers has increased public engagement by providing real-time feedback on physical activity and fitness outcomes. And that is all that I have for you today. I look forward to talking with you again. Have a great day.